So, Dr. Jason Jian, how do we diagnose the ADD or ADHD?
Currently, it's because the state crisis, the government has been cracked down the statements prescriptions. So many primary care physicians, family physicians just refer patient to the psychiatrists or psychologist, try to get a diagnosis. But I would say for diagnosis of attention deficit, ADD, ADHD, currently still based on clinic, based on history, based on current symptoms and functioning. There's no specific tests like X-ray, CT scan, or blood work to diagnose. Actually, any physicians or nurse practitioners can diagnose the attention deficit, not just psychiatrists or psychologists. Everybody, if they have training in the medical field or in the mental health field, they can diagnose this. Of course, we need to follow certain criteria. Currently, no matter if you are psychiatrist or psychologist or nurse practitioner or family physician, we need to base on DSM-5 criteria, which is kind of Bible in the mental health diagnosis. Number one criteria, so they have to have symptoms or behaviors related to have inattentiveness or hyperactive symptoms or impulsivities, have to have those symptoms at least 6 months in two settings, for example, in the school and in the workplace, or in the school or at home, and home or school settings. Those symptoms like couldn't pay attention or impulsivity just happen in the workplace, not in the home. Probably that's not related to attention deficit. That's probably related to the social situation. Second, you not just have symptoms, also those symptoms will negatively impact your academic or social or occupational functioning. So just have symptoms itself is not. You only interfere, like we just mentioned, people lost their job or drop out of the school or have problem with marriage. That is another criteria we need to diagnose. That's the second one. Third, you need one patient above the age 17 years old. Then you need at least five symptoms. Later, we can show you, commonly we have 18 symptoms. You have to have 5 of the 18 symptoms. Another, those symptoms should be happen before 12 years old. 12 years old, you're perfectly fine. No any problem with the attention or behavior or focus. Suddenly, after 20 years old or 18 years old, you had a problem. That's probably something else. Usually, when patients have attention deficit happen after 18 years old, mostly related to depression, anxiety, substance abuse. Because those mental health issues actually also can cause attention deficit. And in other words, attention deficit actually is a symptom, not a disorder. So you have to happen before the age 12 years old. Last but not least, 5. So those symptoms should not be accounted for by the different psychiatric disorders like depression, anxiety, or schizophrenia, bipolar disorder. But people with depression, anxiety, or schizophrenia, bipolar, yes, they can have the attention deficit. They can go together, but the difference is here. So people with bipolar, schizophrenia, or depression with attention deficit, so when their depression gets better, anxiety gets better, or psychosis gets better, but they still have attention deficit. They still cannot focus. Then we can say probably they have the attention deficit. So this is happening in a clinic setting. We follow DSM-5 the criteria. So you only see for initial evaluation. First time we see the patients. Actually, follow-up also is very important. Why? When we first time we see the patients, like a snapshot. So in this situation, most of the patients came to see psychiatrists. They can simultaneously have attention deficit, depression, anxiety. So at that moment, it's really difficult to say which is primary, which is secondary, or tertiary. This is difficult to establish. So usually we based on how the patient responds to the treatment. During the treatment process follow-up, we found out the patient anxiety, depression get better. And at the same time, the patient attention and also get better. Then we can consider attention is secondary. to the depression anxiety. Or people, depression anxiety get better, but like I just mentioned, attention deficit still is problematic. Even attention deficit become primary concern for the patients. Then we can say patient probably have both depression, anxiety, and coexisting with the attention deficit. So here I can give you another 2 case scenario. I have a patient, a female patient, probably she was a nurse, had fight with her co-workers, even with husbands. Almost everybody say she had bipolar disorder, and she also admit she had bipolar disorder. So when she first time saw me, I probably agree her consideration. She actually first mentioned she had bipolar. I thought she was diagnosed before. So then I started her on mood stabilizer. We commonly use the mood stabilizers, lithium, Depakote, and nematrigine. First try lithium. She had a severe side effects, not respond to lithium well. Then Depakote, she didn't like it. Third, she feel just worse and worse. Then we realized we probably bought the wrong treatment. She even told me without those mood stabilizers, she actually can get better. She's much better. So what can we do? Eventually, based on her history presentation, especially we asked her when she was very young, she said actually she had this problem not just most recently. She had the problem since preschool, she told me. Even her mother said she was having a learning disorder when she was young. Wow. But she actually performs relatively well, not too bad. So that's not support the bipolar disorder. So then we changed to stimulants like andro XR. Eventually, she get much better. Really, right now, this is real case. She's my patient right now. She performs much better on stimulants. So you can say the diagnosis sometimes can be changed. Initially, we thought it's a bipolar disorder. Then, actually, eventually, based on the follow-up treatment responses, we consider she had just attention deficit, ADD, ADHD. This first case. Second case is I have a young guy, probably is around 40 years old. He's IT programmer. He had a problem recently, divorced with his wife. Also, he said he just couldn't focus on the job. She gave me a description of attention deficit like a textbook, exactly like the attention deficit. So I did not have doubt initially. So we diagnosed his ADHD because she, like I said, she had a marriage problem, she had a job problem. He kept complaining he had an attention problem. So we start him andro, plus serotonin. But attention deficit gets better, but he still feel like things didn't change his life. Then he feel like attention deficit is not his big problem. Then he feel down, feel sad, feel depressed, no motivation to do job. I say, how could that happen? You're supposed to get stimulants to make you more energetic, right? So then we realized we bought the wrong treatment. Eventually, we changed from andro to Zoloft. So right now, he's on Zoloft, performs much better when he's on stimulants. Why? It's because most of the patients with the depression, their primary concern is they don't have enough serotonin. And andro serotonin cannot increase serotonin, only norepinephrine, dopamine, but he had enough norepinephrine, dopamine. He thought he probably also had attention deficit. Actually, based on how to respond to the treatment, we realized no, he did not have attention deficit. Actually, it's depression. Depression can cause problem in the marriage and the job. So there's no big difference, but the difference response to the treatment will be very different. So that is how we diagnose attention deficit, based on DSM-5 and based on how to respond to the patients. And every physician with training can be diagnosed as ADD, ADHD, not just psychiatrists or psychologists.
Thanks for Dr. Jian answering all our questions today, and don't forget to subscribe our channel so you won't miss Dr. Jian's following video. And thanks for your joining our studio again.